And yep. Prathap, I'm delighted to be here with you in Vellore today. You're a famous psychiatrist. You are well known throughout the Cochrane Collaboration for leading evidence-based healthcare in South Asia. Can you tell us a little bit about how you came to engage in this program of work?
Hey Paul, thanks. That's very kind of you to describe me like that. But let me, start by saying I got involved in this purely by accident. In a way that I was at a particular place at a time when the collaboration had just started. I was working in Oxford, and I was working with Professor Gelder at the Warnford Hospital when one of his senior residents, Clive Adams, suggested that I answer a question which I was, doubtful of why practices differed in the UK as well as in India by doing a systematic review. And it turned out that Clive was one of the founding editors of the Cochrane Schizophrenia Group and had been influenced by the entire movement which started off in Oxford, as you know, in 93. And I was a registrar in 94 or 95. So I got involved in one of the earliest Cochrane systematic reviews that the Schizophrenia Group did. So that's my introduction to actually doing the reviews. But when I came back to India, I discovered there were many questions that people were asking me to answer, for which the Cochrane Library, where the reviews are published, were able to give me reliable answers. And that's another reason why I got involved in this, because not only could you answer questions for yourself, but you could find reliable questions that other people were asking that the Cochrane Collaboration was able to provide. So that's more or less how I got involved with this incredible movement.
Some people might ask how reviews of schizophrenia done in Oxford have any relevance to healthcare in India. Is it true that reviews in Oxford have any relevance to here, or do some of these Cochrane reviews have relevance in low-income countries?
That's a good question because, Paul, that's a very good question because there are certain reviews done by the Schizophrenia Group which have really changed practice in the UK. And I can remember a couple of them, one which involved case management for people with schizophrenia, which suggested overall that case management does not achieve the aims that it was established for, which is to keep people out of hospital. And on the contrary, there was evidence that it kind of increased the number of people going back to hospital. And this review changed practice in the UK. However, and subsequent reviews done elsewhere in the UK and in the US, trials from these countries showed that assertive case finding and management in the community was a very useful intervention. Now the problem is we don't have case managers in India, neither do we have any assertive teams. So those reviews had very little relevance to the practice and the organization of care in schizophrenia. So you're right, there are reviews which have particular relevance to interventions done in high and middle income countries. There are other reviews in the Cochrane Schizophrenia Group's module which are universally applicable because they involve responses to treatments which are available here and can be given, and people respond equally well. So wherever health systems are involved, you'd find that relevance of reviews differs from where the interventions are being done. And more importantly, sometimes the questions asked by reviewers living in low and middle income countries may have a slightly different focus than the questions that may be raised by people who live elsewhere, because the conditions that affect them may differ. So yes, there are differences.
Prathap, I know that you have extensive contact with policymakers and interaction with people in Delhi and at state level. Could you give us some examples of how you interface with policymakers during your work?
Paul, that's a very, very interesting question, because actually speaking, when we started this whole process, I had absolutely no contact with policymakers either in Delhi or anywhere, because I was just a clinician. But it became very apparent that in the process of doing reviews, that if you want these reviews read and used, people in the country need access to the Cochrane Library. And that's when we started trying to actively interface with policy makers and with organizations who could support the process. And you may remember how many years ago, in I think 2003 or 4, that we offered to do a workshop for the Indian Council of Medical Research, because we felt that that would be an organization that we would love to partner with, because they are the key research organization which provides research evidence to the ministries, to the government. And it was a privilege to be able to get all of the senior Indian Council of Medical Research officers under one roof for a workshop, where we could discuss the usefulness of systematic reviews and show them how having access to these full reviews would give them really the research experience, which could then be